Hello everyone, this is Dr. Khatereh Khorsandi. First of all, I'd like to thank the scientific and organizing committee of ICAZ-2022 for inviting me and give this opportunity to have a talk on 5th International Conference on Applied Zoology. Well, my presentation is about an overview on antimicrobial photodynamic therapy. As we know, since Alexander Fleming discovered penicillin, the antibiotic that developed for different research and use against different bacteria, also increasing in drug resistance has been developed. The number of deaths caused each year by pathogenic bacteria estimated will increase to 10 million by 2050. So new biocidal substances or method to effectively cope with just drug resistance is needed. Here I show that the impact of antimicrobial resistance, as you can see here, the antimicrobial resistance in 2050 can reach to 10 million, which is more than cancer and other like disease and even more than diabetes or other serious disease that we have now. So also it will develop in, around different countries. Here I bring that antibiotic and strategic against multi-drug resistant bacteria in past 20 years, as you can see. And among each resistance bacteria, different antibiotic is developed. So, and recently we can see that by different antibiotic against different bacteria. Also, the rate of resistance to this antibiotic is increased. So, among the different strategies for overcoming this resistance, I want to talk about sunlight that's used as therapeutic agent for more than 3,000 years in different civilizations against different problems in the skin like psoriasis, vitiligo, and different disease. Light-mediated diagnostic means that it can use for purpose in therapy or diagnostic. It has different wavelengths, and according to the purpose that we want, we can use different wavelengths, and they have different penetration. And among the different wavelengths, they have different action like drug release, particle targeting. So they have many applications. Here I show that in one of our recent paper, the different mechanism that bacteria can be developed for drug resistance. It could be the changing in antibiotic alternating enzyme. It could be changing in antibiotic influx pump, antibiotic degrading enzyme, or other strategy that will lead to drug resistance. Antimicrobial photodynamic therapy or antimicrobial photodynamic inactivation is a light-based treatment method such as laser-modified medicine and photodynamic therapy that have been noted as a great potential against microbial infection. Antimicrobial inactivation, also known as PACT, that is photodynamic antimicrobial therapy or photodynamic inactivation, and is alternative method to fight resistant microorganisms, including bacteria, fungi, parasites, and virus. Here I show the APDI mechanism. As you can see, for having a PDI process, we need a substances that we call it photosynthesizer, a light in a specific wavelengths, and oxygen molecule. This reaction leads to producing rust, as you can see here, which result in DNA damage or destruction or cell envelope in bacteria, which including lipid or other component that finally lead to the cell death. Here I show that the effect of photosynthesizer by attaching to the cell wall or entering the bacteria and applying the light-producing rust, which lead to membrane and DNA damage. PDI has different advantages over the routine antibiotic therapy, such as broad therapeutic window can inactivate pathogen in biofilm form, eliminates develop of resistance, destroys secreted virulence factor, and also is safe for human tissue, and it cannot lead to resistance. Photodynamic inactivation can result in different morphological or functional changes in bacteria. Functional changes or functional damage can be the loss of enzymatic activities, protein oxidation, formation of protein-protein cross-link, or inhibition of metabolic process, and morphological alternation, including the alternation of mesosome structure. Direct damage to the cell envelope can lead to leakage of cellular content, and following the inactivation of membrane transport system. As we know that there is a difference between gram-positive and gram-negative bacteria. Here I show that gram-positive bacteria has a large peptidoglycan membrane, but on the other side, that gram-negative bacteria has the outer membrane and a small peptidoglycan. And so to perform a PDI, PS need to penetrate or at least bond to the cell wall of bacteria, and then by attaching to the plasma membrane or in cytoplasm can act and diffuse into bacteria cytosol. Therefore, a PDI gram-positive bacteria, which is like fruit structure of peptidoglycan, is much easier to gram-negative bacteria with a thick of outer membrane. And here I show the effect of PDI on different gram-negative, such as E. coli, or gram-positive, such as Staphylococcus aureus bacteria. Another structure in bacteria is biofilm. In many environmental bacteria exists as a complex that we call it biofilm, that is the matrix of extracellular polymeric, including polysaccharide, protein, and lipid. This structure gives resistance to bacteria and increase virulence and resistance to both antimicrobial therapy. So also biofilm is resistant to PDI, so we need high dose of PS and high dose of light. And by just penetration of light and photosynthesizer to the structure of biofilm, we can inactivate the bacteria in biofilm form. There is a different mode action of photodynamic therapy in compared to antibiotic. Antibiotic can just act on the cell wall, cytoplasmic membrane, protein biosynthesis, or DNA replication. But PS and we use in APDT can at the same time affect this all sites, so can lead to better inactivation. There are unique or cationic PS, according to the purpose that we want to use against which bacteria, gram-positive or gram-negative, they can just inactive, like anionic PS is act better against gram-positive, and cationic PS act better against gram-negative bacteria. Also, there is this strategy, like we can use at the same time antibiotic with APDI, so it can be the synergy between this method, such as mRNA inhibition, this disinfection of PVP, DNA damage, inhibition of synthesis of DNA, modification of lipopolysaccharide, depolarization of membrane, and different mechanisms that can lead to synergy and inactivation of bacteria. In this regard, there is a challenges in antimicrobial PDT. One of the most challenges is the hydrophobic characteristic of photosynthesizer, that they can just that lead to not penetrating in the cell membrane, and under physiological condition, they just like to form aggregate. Another thing is a low selectivity of photosynthesizer to their desired high rate. In this regard, we can use a nanoparticle as drug carrier, as we use that nanoparticle can dissolve in matrix, absorb, and PS can dissolve in the matrix of nanoparticle, or absorb in the surface of nanoparticle, and we use it as a carrier for PS to the desired site that we want. Here I show that the mechanism of antimicrobial activity of nanoparticle, and against different mechanisms of resistance, that nanoparticle can be used as drug delivery system for overcoming the different mechanism of resistance of bacteria. Nanoparticle that can be used in a APDT can be just divided in different groups. photosynthesizer can covalently bind to the nanoparticle, including dendrimer nanoparticle or lipid conjugated polysaccharide or liposome or solid nanoparticle, or like they can be on the surface of nanoparticle, or it could be like non-covalent encapsulation of photosynthesizer into nanoparticles such as nanomicelle, liposome, nanocapsule, or different. Another group is nanoparticles themselves act as a photosynthesizer, like thiiodo-fluorine or quantum dot that they act as a photosynthesizer in photodynamic inactivation. Here we have done different research on antimicrobial photodynamic therapy. This is one of our recent paper about antimicrobial photodynamic and wound healing activity of curcumin that we use in this form and encapsulated curcumin in silica nanoparticle. As we know that curcumin is not a good candidate for dissolving in aqueous condition. So we use silica nanoparticle for increasing its solubility and is effective against different bacteria. It shows that curcumin can act as a photosynthesizer and can overcome multi-drug resistance. Here is the experiment that we use. We just encapsulated curcumin in a nanoparticle, and then by using LED radiation against planktonic form and like biofilm form of two different bacteria, one gram-positive and one gram-negative bacteria. Here, this is a graph of characterization of curcumin in alone form and compared to curcumin silica nanoparticle, that as you can see, the absorbance of nanoparticle curcumin increase, which show that the solubility increase. Also, this is the structure of TEM and SEM microscopy of nanoparticle that show that this is in nanoparticle. And we use it against Staphylococcus aureus as a gram-positive bacteria and Pseudomonas aeruginosa as a gram-negative bacteria, as you can see here, in form of nanoparticle in compared to curcumin alone, and control the Staphylococcus aureus in the form of planktonic, and in both bacteria the CFU decrease, and also in the form of biofilm also is lead to decreasing of CFU in the form of biofilm in both bacteria. Another thing, biofilm formation ability of both bacteria also decrease in the form of using the form of curcumin nanoparticle in PDI method. However, at the same time, this nanoparticle wasn't toxic against a human normal fibroblast, which we could have this normal fibroblast in the wound area or other area that we use for infection. So it is a safe strategy. Another form of nanoparticle that can be used, they are metal nanoparticle, and such as silver or gold nanoparticle. As you can see, they have extremely small particle size, so they can have very large surface area that a large dose of PS can absorb on the surface of gold or silver nanoparticle. In this regard, we done a work like photodynamic inactivation with curcumin, but using silver nanoparticle for against 1 gram negative bacteria, Pseudomonas aeruginosa, in the form of planktonic and biofilm form. First, we just characterize the silver nanoparticle that they are nano, and then we use curcumin and silver nanoparticle against planktonic form of bacteria, and we saw that in compared to nanoparticle alone and curcumin alone, using the combination of curcumin in the form of silver nanoparticle lead to decreasing CFU of bacteria in planktonic form, and also the biofilm formation ability decrease. At the same time, this nanoparticle just inhibit the just lead to killing of biofilm of bacteria, and also the cell viability of human dermal fibroblasts in the presence of nanoparticle didn't change significantly, show that this method is safe against also in infected area that we have normal cell. Also, we we wanted to know that the mechanism that this nanoparticle and PDI lead to the destruction of bacteria. We find that in the presence of curcumin nanoparticle, the ROS increase in compared to curcumin, and also in compared to control. And also we just introduced like that, and this increasing ROS is important as a mechanism of this nanoparticle. We also find that the glutathione peroxidase activity as a important enzyme that is important in bacteria, which lead to the biofilm formation in bacteria. Also, the activity of this enzyme significantly decreased in the curcumin nanoparticle form in compared to control, in also in curcumin alone. And so this method is very good candidate for an inactivation of Pseudomonas aeruginosa. As I said, another group of nanoparticle are nanoparticle that themselves act as PS. In this group, I just bring some example like fullerene, graphene oxide, titanium oxide, upconversion nanoparticle, quantum dot, a 2-photon absorption nanoparticle. As you can see, they can act in different wavelengths, like red by using blue irradiation or red irradiation. We can use this nanoparticle as a PS in photodynamic therapy. Another strategy is combination therapy with APDT. That in one of our research, we use flavonoid compound routine, and in combination with photodynamic inactivation, I'm using methylene blue as photosynthesizer against gram-positive and gram-negative bacteria, as you can see here, by using combination therapy. The planktonic and biofilm form of bacteria decrease in compared to methylene blue alone. Also, in the form of biofilm, we saw that also decrease in the CFU in compared to control and methylene blue alone. Another thing was that this combination doesn't show phototoxicity against human dermal fibroblasts in the low concentration that we use. We display that alone. What was the mechanism and how methylene blue acts as a photosynthesizer in a combination with routine? We saw that methylene blue alone as a photosynthesizer just there is in 2 form, monomer or dimer. And in the solution, methylene blue tend to form dimer, which is lead to decreasing its phototoxicity. But when we use like routine, it leads to increasing the monomer form of methylene blue, so it can lead to stabilize and stabilize the monomer form, so increasing the APDT efficacy. We have also shown that APDT can be used for virus inactivation. In this regard, we have introduced nanoantiviral photodynamic therapy as a probable biophysical chemical management in SARS-CoV. Like in this regard, also there are other research that have been done and using and suggesting APDT for COVID virus inactivation. I like to just show like antimicrobial photodynamic in clinical application. It can be used against bacterial infection and non-healing ulcer like wound healing. And APDT can use for dental infection, including periodontitis or endodontic, and also can be used for leishmania. Here, there is a before and after photo of using PDT in clinic for against different skin problem. And as I said, APDT can be used for dental infection, dental caries, endodontic, peri-implant, fungal infection, periodontic, or other problem that is in oral infection. Also, APDT can be used as bacterial infection, and it has a good effect on wound healing by destroying the bacteria in the wound area and increasing the wound healing. APDT can be used in infected diabetic foot ulcer, as we know that diabetic foot ulcer is like one of the increasing problem these days. So PDT has an antibacterial effect can reduce the total and pathogenic microbial load in diabetic ulcer, and in this regard, it could be useful for increasing wound healing. Here I show that the using of photodynamic therapy or photodynamic inactivation that can be used with different nanoparticles against different pathogenic and can be used in different phases of wound healing and can increase the wound healing process. As conclusion, I can say that photodynamic therapy and also photodynamic like inactivation can have a good effect in decreasing the resistance in different kind of bacteria and different kind of microorganisms, as it can be combined with nanoparticles and apply against different pathogenic bacteria or fungi or different microorganisms for increasing the for decreasing the drug resistance. Thank you all for your attention. If you have any question, I would be happy to answer.